This is a very interesting CT scan, HR high resolution CT scan of the chest, where we can see the lungs parenchyma very neatly and cleanly. Now this CT has a very good findings. When we zoom in, we can see that when I had told to see a normal HRCT chest, I had told that the lung parenchyma should be more of a equal on this side. So this is R, means the right side. So this is right sided lung parenchyma and this is left sided lung parenchyma. So if we compare, this size is almost around maybe 1/3 of this right side. So there is markedly reduced lung side on one side, which is on the left. See it here, on the right side the lung appears very normal because the bronchovascular markings are pretty good, they are pretty okay. There is no any particular lesion and there is very fine this bronchovascular markings going up to the periphery. But on the left side, see, there is markedly reduction of the lung space volume. So the volume is much less. See, this is almost around half the lung of the right. So there is marked reduction in lung parenchyma on the left side, which is very typical feature of a restrictive lung disease. Restrictive lung disease means there is restriction of the lung volume because of some reason. So there is definitely reduction of the lung parenchyma on the left side. Now I had told earlier also, whenever there is old infective lesion or any lesion which has caused significant damage to the lungs, repetitive damage to the lungs, this repetitive damage will lead to fibrotic bands, because otherwise the lesion should completely resolve to its almost normal lung parenchyma. But in some instances, because of the extensive damage or very aggressive bad bacteria which is resistant to the treatment, the repetitive lung damage will lead to fibrosis and it will not resolve actually. So fibrosis will simply cause irreversible uh, this formation of streaks of the fibrotic bands, which will cause fibrosis and which will actually shrink the lung parenchyma. So once there is shrinking of this lung parenchyma, the lung volume will become less because of the shrinkage of the lung parenchyma. So what we are able to see here, compare here also, on the right side there is huge normal lung parenchyma, but on the left there is significantly shrunken lung lobes. This shrinkage is because of the fibrotic bands which appear hyperdense or dense white streaks of the bands. See, this is not very dark bright, this is not like very dark bright, this is not very dark bright, and there is no shrinkage. But here, see, it is so much dense dark white, very irregularly placed bands, dark white bands. Here they are very purposefully neatly placed bands, so which are normal bronchovascular markings, but here they are placed like haywire. There is no typical pattern, so these are typical fibrotic bands. So whenever these fibrotic bands, what will happen, there will be shrinkage of the lung parenchyma, and the most one more important thing is there will be pulling of the mediastinum. Pulling of mediastinum is very important. I told earlier also, this is mediastinal structure. This heart is in the anterior mediastinum and it should have been in the center. In center, how? Whenever we divide this heart into the middle, from the middle, the heart should be actually in the midline. So just see, this is the vertebra, this is the vertebral spines, this is vertebral spine, so this is midline. So this heart, which has to be in the center, it should have been ideally like this. This was his ideal location, almost half on the left and half on the right. But in here the heart is completely shifted to the left side. It is completely shifted to the left side. That is because this fibrosis bands, it has pulled this entirely to the left side, and the same thing can be seen here. See, this mediastinum is completely shifted to the left side because of the fibrotic bands of the lungs. This lung has completely pulled all the mediastinum toward this side. So this is a very interesting Hrct chest which shows significant fibrotic bands because of the large lung parenchymal lesion which was there in the past, which did not resolve the lesion but it caused significant fibrosis. What we can see is there are some bronchiectatic lesions also. Now what is bronchiectasis? Now bronchiectasis is an abnormal permanent dilatation of the bronchi or bronchioles. So this is a normal bronchiole. What is bronchiole is? Bronchiole is a structure which carries air. So it usually has a thin margin and it contains dark black air inside this. So this has black air inside and it has a thin margin, and you can see them seldom. You won't get it very in frequent manner. So this is a typical normal bronchiole because you can see the air inside and there is thin margin. Now see in here, we can see that air is there. The air is there in the middle of this. The air is there in middle of this, but the thickness of the margin is markedly increased. Now just compare these bronchioles with this. Compare the thin wall of this and compare the thick wall of this. So these bronchioles are very thick compared. So these are thick bronchioles with air inside. So this is permanently dilated bronchiole with thick wall and which presence of air inside, and these are like present nearby very closely. They should not be present this much close. They should be placed apart. So in here there are so many bronchioles which are very nearby with thick margins. So presence of so many fibrotic bands, presence of loss of lung parenchyma, mediastinal shifting and bronchiectatic changes, it all tells us that the patient had previous lung parenchymal insult which was significantly large, because we can see this lesion from starting from here 1 2 3 4 5 6 7 8 9 10. So it is seen in so many lung fields. It means the patient must have had a large pneumonia which was not treated properly, or maybe the patient had tuberculosis which was not treated properly. So instead of the resolution, it underwent a complication and led up into the fibrosis. It can recover completely and completely resolve, so it will not look like this. Otherwise it can get complicated and lands up into fibrosis like this. So this has fibrosis, bronchiectasis, loss of lung volume, mediastinal. So many typical findings are here. That's all for now, and thank you.